resilience. If a person or a community or a population can bounce back after a crisis, if they can help themselves to come back and resume life. What we see as children and mothers and persons being in need of emergency assistance all the time and every time, whether it's a good or bad year in terms of, for instance, harvest or rainfall. A sharing of early warning information and analysis in a regional way, so and to inform decision making and also targeting of the poorest. And we could do that by introducing the tools of household economy analysis to look at the income and revenues and detection of the ultra poor that were not really recognized as such before, and therefore promote cash transfers and social targeting in Niger. And another example is free access to healthcare, exemption of user fees, to increase coverage, to get families to be able to have their children treated before it's too late. The way how to be resilient friendly is to support local capacities and national NGOs and work hand in hand with the colleagues of the government services, health services, nutrition services. This has created much more expertise to help treat nutrition in Mali, in Niger, in Chad, in Burkina Faso, where there was hardly any national capacity, specialized nutrition treatment capacity before. Yes, there is high recognition of the fact that the structural underlying causes need to be addressed, that the current cycle of crisis is not going to go away by itself. Worse, that the cycle of crisis is intensifying. For me, if we could have the courage to find one common objective, for me that would be limiting excess mortality and acute malnutrition for the children under the age of 2 and pregnant and breastfeeding women. That health centers in a village in Niger or in Burkina Faso or in Chad will not be overwhelmed by a constant stream of acutely malnourished children every day, of every month, of every year, regardless the level of crisis.